Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Courtney. So today's episode is all about lips. So we're going to talk about anatomy, what makes them unique, certain conditions that we typically see, and how to protect them. So Courtney, let's dive right in. So why are lips different than the rest of your skin?
A few things. So lips actually don't have any oil glands, which I think is really interesting. So basically, they can get drier quicker than other parts of your body that do have oil glands, the rest of your skin. They also are much thinner. The skin is much thinner. So I think it just puts them in a spot of being more vulnerable to different conditions, especially dryness. We see that in the wintertime all the time, cracks and fissures, things like that. They lack melanin, so there's less protection from the environment. I know we've seen quite a few skin cancers on the lips, so we'll kind of get into that later. But yeah, they're just they're different. They're different than the rest of your body.
Yeah, I mean, lips are such an important part of our human identity. It's been a symbol of beauty for millennia, and many women have really taken focus on to their lips because it kind of shows fertility, beauty. And that's why we've seen cosmetics specifically for the lips to enhance the appearance, the color, and the hydration. And it's always been a focal point of our appearance. So I do think that that's why we see such an emphasis in cosmesis.
I think there's definitely been a rise to how much people have paid attention over the past few years. I mean, you look at things like fillers, you look at even, growing up, I don't feel like I ever had like a lip mask. I mean, we always had our Burt's Bees and our Carmex, but we never really had like true lip masks. So it is interesting to see this, uprise of the importance of lip health, number one, but also the appearance too.
Yeah, I mean, I think that treatments for the lip to actually change shape and really kind of, alter anatomy really came from like using fillers.
Yeah.
And we have just so many more options now. I think prior to that, we really didn't. We were masking it, usually with, skincare products and then in extreme cases, surgeries and, old school like silicone, that's always a bad idea.
Yeah. I don't know if you remember the Kylie Jenner lip plump challenge where people would use suction to try to plump their lips. And sometimes people would get stuck. Their lips would get stuck in whatever container they were using. It was really bad. Just be
a blowfish.
Yeah.
All right. So I can definitely see why people focus in on the lips. But as dermatologists, we see a lot of patients who come in for lip concerns. So what are the most common things that we see in our office regarding the lips?
I think most commonly, definitely dryness, chapped lips. We do see a lot of angular cheilitis, which...
what is angular cheilitis?
It's a condition that can happen normally on the creases of the mouth. We tend to see it with moisture. So a lot of times people who maybe drool a little bit in their sleep, things like that, it kind of... those creases kind of holds that moisture. So it creates a rash in that area. So it can look a little red, a little scaly. I would say most commonly, those are probably the two main concerns.
Yeah. So with angular cheilitis, we see that a lot with droolers, especially at nighttime. But we can also see that in vitamin deficiencies. So vitamin B deficiencies can lead to angular cheilitis. So the easy fix with that is, supplementing. Exactly. But oftentimes we have to use like antifungals, anti-inflammatories to really help reduce that inflammation because it can be pretty painful.
Yeah.
You can get cracks in the oral commissures. You can get a lot of inflammation, discomfort with eating, especially salty or acidic foods.
Spicy food, yeah.
So it is something that can really, really bother your lips.
Yeah.
Also, we see a lot of Accutane patients, right, for acne, and that really dries out your lips. That's probably the number one complaint we get with Accutane, right?
Yeah, and I know we've both gone through that. That was definitely my biggest complaint.
Yeah, so I mean, constant hydration is key. Using thick ointments, Aquaphor and Vaseline are great. Sometimes we actually have to use steroidal ointments too to reduce that inflammation, allow the lips to heal because those cracks can be very uncomfortable.
Yeah, I always recommend Dr. Dan's, which is over the counter. It has a little cortisone in there too, which I think can be helpful when you're really dealing with those cracked lips, the really uncomfortable, painful, in the middle of the winter kind of cracked lips. So Dr. Dan's Cortibalm, I think it's called, is so nice.
Yeah. I mean, the cold air and the wind, definitely can wreak havoc on your lips, but also the heat that we experience, right? So a lot of dry heat now with heating our homes, and that also dries out our lips as well.
I hope everyone got their humidifier for Christmas.
I actually just ordered one. It's coming in today.
Some other things I think we see too, cold sores. And I think those get confused a lot of times because they can present differently in some cases. Usually you're finding them on the corners of the lips too, or like the
border.
Vermilion border. Yeah.
Yep. And this is just a reactivation of HSV. So herpes simplex virus is the virus that's associated with cold sores. So many times it comes out with stress. So it could be emotional stress. It could be physical stress. So, I get them. They're annoying.
Yeah.
And I usually hit them hard with some Valtrex and knock them out.
But yeah, I find mine come in the winter time, like this time of year, especially when it's cold. I think just the dryness leads to this potential for cracking, and the cracking leads to the, it's like kind of a little cycle. So Valtrex is definitely in my medicine cabinet.
Vitamin V.
Yeah.
Another thing that we see, especially in my pediatric population, but even adults, licking dermatitis.
Yes, that's so under talked about.
It really is. And honestly, I think everyone's guilty of it. I am. And oftentimes, when your lips are dry and you're too lazy to use an ointment, you just kind of like keep licking your lips, thinking the saliva is going to help hydrate that skin, the lips, but it does the opposite.
Those enzymes, they break down the skin. So I always think back, I took this science class back in middle school where we did this experiment, letting different foods like melt in our mouth because of the enzymes. And so whenever I lick my lips, I always just think about those enzymes breaking down my lip.
Yeah, and especially with our pediatric patients, like I see a lot of lip lickers dermatitis, and literally you can see like the skin around the lips, the cutaneous lip being really red, inflamed, even thickened.
Yeah.
And it can lead to hyperpigmentation. So it is something that needs treatment and really conscious diligence of not licking their lips.
I think sometimes people doubt that they're doing it. People do it subconsciously. So sometimes even with parents, you'll say, oh, I think it's lip lickers. And they say, well, they don't really lick their lips. But I think it's such a common thing that everyone does. They don't really take notice to it. And then once you see it, then you can't stop. You're like, you're paying so much attention to it. So,
so in addition to our saliva with lip lickers dermatitis, there are other offenders that can worsen skin conditions of the lips, especially in the wintertime. So fragrances, I tend to find that people are really into essential oils and they're like putting it everywhere, thinking that it's a cure-all. But sometimes they're sensitive to the fragrance. They're allergic. They develop an allergic contact dermatitis. Definitely leads to inflammation in the lips.
Sometimes I've had a few patients actually allergic to beeswax, and so they can't use most brands of chapstick. That's when I'll normally recommend just the Aquaphor. I can't remember if it has beeswax in there.
I'm not a huge fan of chapstick. I actually hate chapstick. And the reason why is that it has a lot of ingredients that people can be sensitized to, fragrance, other preservatives. And these patients are thinking that they're improving the hydration of their lips. And if they tend to be sensitive, it's actually making it worse, drying them out and causing more inflammation. I often see that with our Accutane patients. So they're all just kind of putting on more chapstick, and it's actually not helping.
I think chapstick too can contribute to the onset of perioral dermatitis. So a lot of times you will see patients and maybe they have a rash, those pimples that, don't quite pop, usually around like the nasal area and the mouth area. And you've tried all your acne meds and it's not helping, and it's, just getting worse. And sometimes your dermatologist might ask you, have you tried a new toothpaste? Have you tried a new chapstick? And those are questions to try to determine if it is that perioral dermatitis, because things that are minty, so things that have like the menthol in them or cinnamon can be really big triggers for perioral.
Yeah. One of my favorite brands for toothpaste is Tom's of Maine.
Yeah.
I usually recommend that to my patients who I suspect are sensitive to some of these ingredients. With perioral dermatitis, I usually have all my patients kind of switch off, and they tend to do better.
Yeah. Yeah, I like the CeraVe healing ointment for my lips a lot. And I'm always, Aquaphor girly on the lips. But I remember the Carmex days for sure. And now Burt's Bees has all these different like scents and stuff. I did used to really like the vanilla bean scent and some of the other. Yeah, it's cozy.
So cool fact, Burt's Bees was started in Durham.
Yeah.
And you can actually see the original store, right?
Yep, I've been.
Yeah. In the tobacco district.
Yep. Yeah.
So
I used to pass by it a lot when I lived downtown. It's cool. And I've met people who work there. I mean, it seems like a cool, fun company.
Yeah.
So.
Cool. And then lipsticks, right, can also contribute. Which lipsticks do you typically see are common offenders?
It's usually not so much. Like, I feel like it's patients who are trying lipstick who normally don't wear lipstick. It's that introduction of like these new, like, I guess chemicals essentially on the skin. Like myself, I don't really wear much lipstick, if any. And I feel like when you are not used to putting that on your skin, then you can kind of get that like allergy.
Yeah. And I feel like some women look for those almost liquid lipsticks.
Yeah.
And they have that, paradoxical effect that they can dry out your lips, correct?
Yeah. Like the lip stains were really popular, and I guess probably still are. But the lip stains, which some people were having difficulty even like getting off their lips. And I think that is such a red flag. If you can't get it off, that concerns me. But that was a really big trend, I think, last year.
Yeah. In addition, there's a lot of lip treatments available. So you alluded to like those lip masks. Some of them are very hydrating. I really recommend those, but a lot of them also have active ingredients such as HA, BHAs.
The lip scrubs. Yeah.
And that can be also irritating and drying.
Especially the mechanical scrubs where, we've talked about St. Ives many times before, but those
Don't use it.
Yeah, do not use if you value your skin. But those mechanical scrubs, I mean, I think they're, I've never really felt the need to consistently exfoliate my lips. I think by maybe when I wash my face, maybe I'll do like a little, I wash kind of my full face, just go at it. But then, I feel like my towel is kind of like doing whatever exfoliating I need. But I think just be mindful of things like that.
I don't think I've ever exfoliated my lips like intentionally.
I was gifted a homemade lip scrub years ago. It was
what did it have, beef tallow?
No, this was like before beef tallow was even like a thing. It was like shea butter, sugar. There was like sugar to get the scrub, I guess. Honey. I mean, it was like it was made in a kitchen. It was not, FDA grade at all. But I don't know. I used it maybe once or twice and just didn't ever use it again.
Probably a good idea.
Yeah, it's like my first year in dermatology. I was like, oh, maybe this is good. I'm like exfoliating exfoliate everything, but it was not great. So
yeah. So since a lot of people are experiencing a lot of lip irritation, dryness, we're going to come up with a little, guide to surviving the harsh winters. So what are some ingredients that we look for, products? What do you recommend?
Lanolin, ceramides, squalene, hyaluronic acid. We've talked about numerous times, our go-to with layering the hyaluronic acid with, Aquaphor or Vaseline. Like I said, beeswax is another one, but patients can be sensitive to that. So I think starting with some other less
Same with the
offensive.
lanolin too. Like there are people with lanolin sensitivity, which is also found in Aquaphor.
Which is a shame. But
I love me some Aquaphor.
Shea butter is another where I feel like some people do well with it, but some people it's just a little inflammatory for them. So glycerin, things like that you can add in. Most of these, like I said, you can find in something like a CeraVe healing ointment. I think Cetaphil even has a healing ointment now. Plain Vaseline. I know they make the cute little Vaselines. I love those.
Some of them are flavored and scented. Do you see those?
I've seen those. Ones? Yeah.
Amna had one, and I'm like, where did you get this from? And I'm like, no.
The only thing about those little tubs, they're so cute. But when you have nails, you have to do the nail trick, which you have to like push your nail up so that you don't get Vaseline under your nail. It's like a whole trick.
If you don't have nails?
Then you do it the normal way.
They are cute though. They're adorable. All right. So those are things to look for. However, there are things that we should avoid. So we talked about fragrance. So avoiding those type of products. These cooling balms. So these are pretty popular. They contain menthol or camphor, but those can be irritating as well. Yeah,
I think they feel nice at first because when your lips are like red and inflamed, especially, and I think almost everyone has been at that point where, you know, your lips are cracked. You pick the crack, which you should never do. They will feel 10 times worse, and then they feel swollen. They feel like hot and swollen. Then so you're thinking, oh, let me put the, you know, camphor on and it'll cool it down, but it's just making it worse. So don't do it.
And those matte lipsticks that we talked about.
Yeah. I remember like your girls are too young, but they probably still do the little flavored like lip glosses.
Oh my God. Do you know Asia?
I used to have a cherry roll-on one, and I loved that. And it tasted like cherries. It was I loved it.
Yeah, Asia is all about that. So she like gets these little like lip gloss kits, and then she puts them on, and she thinks she's like so fancy.
Yeah,
she's like, "Oh look, Daddy, I put on some lipstick."
Yeah,
like, okay, yeah.
So cute.
So, and we talked about exfoliation. So, what's the recommended frequency and types of exfoliation?
Everyone's different. I like and think, you know, maybe a once a week, once every other week. I really don't think you need to do this like bi-weekly ritual with the lips. Like I said, I try to be mindful of those scrubs because of some of the acids and ingredients in there. I think sometimes just doing a nice, like, you know, wash, pat dry with my towel, and then immediately putting on that hyaluronic acid and, you know, Aquaphor or Vaseline tends to do the trick for me. So maybe a weekly, every other week.
And if your lip barrier is compromised, if you have cracks, a lot of irritation, don't exfoliate. It's just going to make things worse.
I think people think and assume if something is dry to exfoliate the dryness off, but you get in that cycle where you're just exfoliating more, you're getting more dry. And instead of adding that moisture back to the skin to repair it, you're, you know, again, you're in the cycle. So I think just focusing on moisturizing when they are dry is key.
Absolutely. So when your lips are compromised, what steps should we take? Humidifiers we talked about. So that moisture in the environment will keep your lips from drying out. Using ointments, especially at nighttime. I love coating my lips with Aquaphor or Vaseline before I go to sleep.
Yeah.
To really hydrate that, because I do get really dry at night.
And that can be helpful against the angular colitis too. Putting a little bit in the creases of your mouth. So if you are someone that drools in your sleep, no judgment. I don't, but
yeah, right.
Depends on the night. But if you do, sometimes putting like a little thin layer can just help that drool from sitting in those creases so that you are not developing that.
Yeah. I think one thing that we haven't really spent too much time talking about was protecting your lips from the sun.
I know.
So lips are also sensitive to UV light. It is a site that we see skin cancer. So I've operated on multiple skin cancers on the lips, basal cells, squamous cells. And it is complicated because, especially with squamous cells, it is at a higher risk for spreading when it's on the mucosa, such as lips. So we always want to make sure that we catch these skin cancers early, treat them appropriately. There's also a condition called actinic cheilitis. So it's basically precancerous changes that are happening to the lip mucosa. So we kind of treat them just like actinic keratoses that we see on the skin. And we want to make sure that they don't progress into squamous cell carcinoma.
Yeah, we see that a lot on patients who have grown up in areas where there's a lot of sun, beaches, lakes, whatever. And, you know, a lot of times when you're putting your sunscreen on, you're putting it on your face, but you're not necessarily using it on your lips. And so I think over time, you know, it does present in that really dry, irritated presentation. And I think it's always really fun when we've done like PDT on the lips, photodynamic therapy to treat the actinic damage, how much improvement they get after.
You get a nice
it's night and
cosmetic
day.
improvement.
So nice. So
in addition, I mean, not so common anymore, but like even chewing tobacco, and we've seen skin cancers arise from that as well. So just something to be mindful of. And when you're getting your skin checks, we're examining your lips. That's part of the exam. So if you notice something that's new or unusual, don't wait. Definitely get evaluated by your board certified dermatologist.
Yeah. I really like the Elta lip SPF. They have one. Honestly, sometimes I just like dab a little sunscreen, like a sheer sunscreen on the lips. But there are definitely lip balms that you can get that are SPF specific.
Yeah. And some of them contain chemical sunscreens, and I'm not a huge fan of them because a lot of people are sensitive to the chemical sunscreens. And I actually think like Aquaphor makes one that has the chemical sunscreen in it. Am I right?
Yeah.
So I'm not a huge fan of them just because, a lot of people do develop allergic contact dermatitis to some of those sunscreens like avobenzone and things like that. I don't know, like I have a hard time putting sunscreen on my lips. And the reason why, I hate the taste of sunscreen. Yeah. And it just inevitably gets in my mouth and it is awful and I can't get the taste out of my mouth and it just annoys me.
Yeah.
So I wish there was like a better tasting one.
Well, that's why you got to do the lip balm so you're not like eating it. They make like actual
everything.
Yeah.
As you know.
Yeah. I know. I was afraid we got cookies today in the office. So I was like, oh, those will be gone in 2 seconds. Yeah, I think just being mindful of whatever, lip balm you're using, but making sure that you're using one. But there are new ones that are like more stick. So you're not getting like the goop of the, sunscreen in there. Maybe if you just apply it carefully, I don't know. It's just a thought.
Yeah. So oftentimes people think that they have chapped lips, but it's not always chapped lips. So what are the conditions that we typically see? Some of them we've talked about already.
Yeah. The actinic colitis, I think, is a really big one, especially when people come in and say, I've had chronic lip dryness for the last year. And especially over the summer months, you start thinking, okay, I understand the winter, but we're so humid here in North Carolina that...
And these are the patients who have a lot of sun damage, so you can kind of tell like they've been in the sun and it makes sense.
And I think even frequently, even besides just the actinic colitis, we do see a lot of precancer spots on the vermilion border. Again, I think just when we're putting on sunscreen, people kind of slosh it on this way and don't really think much about these even that upper lid. So I think just being more mindful also when you're applying your sunscreen.
And we do see labial lentigos, which are sunspots on your lips.
Yeah.
So that's indicative of sun damage. So just another warning sign.
Yeah, I know. I think I have one. I want to IPL it. Am I going to have skin cancer? Should I do some PDT? Eczema or allergic contact, like we kind of mentioned. So anything that is creating, irritation or a rash on the lips. So again, those are your fragrances, your essential oils. Sometimes you can develop allergies to things like peppermint or just the, menthol in the lip balm. So just being mindful. Again, I think just keeping things as plain and simple as you can is preferred.
Yeah. And, maybe in the new year, we can talk about some habits to help improve our lip health. So let's give some tips to our audience.
Stop licking your lips.
You hear that?
When you want to lick your lips, if you do it, give yourself a slap on the wrist and go apply your lip balm. That would be my recommendation.
Courtney will come after you.
Yeah, the lip balm. And stop picking because you can run the experiment a million times and I'll tell you it's going to end the same when you pick that skin. I know it feels gratifying in the moment because I've done it, but you peel it and it's like throbbing. I hate that feeling.
But also think about it. Like when you're picking at your lips, your hands have bacteria on them, and you're transferring that, and then you're picking it, and then you're creating this micro trauma, these cuts. Bacteria can get in, other microorganisms, and you can also get germs into your mouth, and that can get you sick.
Yeah.
I have a feeling that my kids do that all the time. Asia's always picking her lips, and it's the most infuriating thing because then she gets sick, and then I'm like, "Why are you picking your lips?"
Yeah.
Yeah.
It's I just that feeling. like I said, every time I start to pick, if I I'm like, wait, because I remember that feeling, and it's not a fun one. I feel like it takes days for it to go down, and it's just, you're suffering. Anytime you'll eat anything spicy, you'll feel it. It's not pleasant. So,
so one thing that I'm going to work on, definitely the sunscreen, the SPF on my lips. I just got to get over that whole taste thing.
Yeah, we'll be on the hunt. We'll look for some,
Maybe that should be a new business venture. Good tasting sunscreen.
Yeah.
edible sunscreen.
It's like the the colored zinc they used to make,
Fruity flavored sunscreen.
You're onto something.
I am.
Yeah. Sure the kids will love it.
Yeah. Other things, avoid fragrances and certain preservatives that you may be irritated to. Avoiding, those toothpastes that you may be sensitive to, those flavors. So.
Yeah. And then, stop the over exfoliating. I mean, be mindful about the lip mask that you're using. Look at the ingredients. If you're seeing things like the word fragrance in the ingredients and it's, 5 or 6 ingredients in, think to yourself, maybe I don't want to use that. Or, some of these acids, again, if your lips are on the dry side, focus on moisturizing and repairing rather than trying to slough off the skin, because that skin is telling you, hey, I'm dry, Yeah,
I need some TLC.
Yeah.
So we had a great discussion about lips and common irritations and, conditions that we see. Some key takeaways. We want to emphasize protecting, hydrating, avoiding irritants, using sunscreen, and also when you are noticing something unusual about your lips, like a growth or, irritation that doesn't seem to heal, make sure that you see your board-certified dermatologist. Make sure that you get it evaluated because it can be the beginning of something more serious. And especially skin cancer, we want to make sure that, you're healthy and, it doesn't progress into anything that warrants more significant treatment. So hopefully you enjoyed this episode. If you have any questions, feel free to reach out. Please subscribe, like, and follow. But until next time, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.